Good morning and welcome to Medicare Made Simple with Medicare Myriam and her co-host Traci from Smart Caregiving. Medicare Made Simple is brought to you by United Insurance Experts. Call today 561-464-CARE. That's 561-464-CARE. Now here are Medicare Myriam and Traci with Medicare Made Simple.
Good morning, everyone, and thank you for tuning in. I'm your host, Miriam Leva with United Insurance Experts. United Insurance Experts is not affiliated with or endorsed by the government or the federal Medicare program. We do not offer every plan available in your area. Currently in Palm Beach County, we represent 10 organizations which offer 49 products. Please contact Medicare.gov at 1-800-MEDICARE to get information on all of your options. The purpose of this show is to educate you on Medicare and to connect you with valuable resources. Joining me is my co-host, Traci Lamb from Caregiving Worldwide. Hey there, Traci, and welcome.
Hey, Miriam, how are you? How are you feeling? I know you weren't feeling well, so I'm hoping you are feeling better.
I am doing fabulous now. I was on a fabulous cruise, and then for the first time, so my family and I went on a cruise. We had a phenomenal time. We went to the Western Caribbean, and it was just amazing. But of course, we came back with a couple of viruses. Nothing so crazy, but it was a pain in the butt to deal with. But yes, we loved our cruise so much. And my husband's like, can we just book our next cruise, please? So
and they're a lot of fun. They are a lot of fun for sure.
The eating.
Oh yes, the eating can get crazy quick. Yes, because you can just get anything at any time, and you just walk up and say, "This is what I want," and they say, "Okay," and you've already paid to be on the ship. So it's like, oh my gosh.
And I have to say that because dinner was just so much easy. Breakfast, everything was kind of like, oh, do you want to have dinner? Let's go. Boom. We could go wherever we want. At home, it's kind of like you get off work and you're like, oh, what's for dinner? Like, now I got to go cook. I got to not only cook or figure out what we're going to have for dinner. Even if we go out to eat, it's like, okay, what are we having? Right? Like, where are we going? That's another problem. But that's for another day. We'll just blame the husbands on that. They can never decide.
There you go.
But I did receive a lot of questions. So today I will address some of the questions that I have received the past few weeks. But before I do that, I know you have some valuable resources this week that you're going to be going over with us, Traci. Isn't that right?
Yeah. I have a couple of new companies that I want to talk about. The first one is a company called Save My Soul, and soul is spelled S-O-L-E. And this is a product. They actually sent me a sample of the product, and it's actually for your feet. Okay. And it's really, really good. I know, when as my dad started aging, the bottoms of his feet especially got really, really dry because of the lack of circulation. And as a lot of times as people age, the bottoms of their feet get really, really super dry. And it doesn't matter how much, lotion they necessarily put on it. You really have to be able to take care of your feet. So this is a product. It's by Peak 10 Skin. And basically it comes not only with a lotion that you're going to put on the bottom of your feet, but it actually comes with an abrasive square. So basically what you do is after you get out of the shower, when the bottoms of your feet are actually still soft, you take the abrasive and you scrub the bottom of the heel of your foot particularly, but you really should scrub the whole foot. And then all of that garbage comes off, all the dead skin and everything that you really need to get off comes off. And then you put the Save My Soul cream on your feet, and then you go to bed at night. And it's on your feet all night, and it is just ridiculous. It is amazing how much difference you feel in the bottom of the feet.
Wow. Because I have I got an athletic foot. I'm always I play pickleball and I work out, or at least I'm trying to.
Yeah.
So sometimes the bottom of my feet just get all,
scaly
little
and
nasty,
stuff. Yeah.
scaly and stuff. Yeah, that sounds good. So you
Yeah,
shower
and it is.
first.
Yeah, it is. It's really good for anybody. I mean, honestly, and like I say, I have just been amazed at the way that it has really, really helped my feet. I mean, it's just your feet feel so much better, and especially when you start doing it on a regular basis. You know, it's like, oh my word, your feet feel amazing. And like I say, you do it after you get out of the shower. You know, because that skin is soft because you've been standing, you know, in water, whether you took a bath or a shower, your feet are wet, so that skin is already soft. So then you take the abrasive sponge that actually comes with it, and you scrape it, and then you put the lotion on, and then you go to bed. So it can actually, you know, sit on your skin for 8 hours. And oh my goodness, it's amazing. So if you want to find it, right now my Safe and Sound site is down. It will be listed on my Safe and Sound site when it comes back up. But you can go to either Amazon.com, and you can look up Save My Soul, SOLE. And it is sold on Amazon. Or if you actually want to go to their website, because they have a lot of different products, their actual website is Peak, PEAK, the number 10, skin.com. Peak10skin.com. So they have multiple products, but this is the one that I actually have tried and I really, really like. So you might want to try some of their other products as well. They're great company.
Yeah, I wonder if they have something like, because my husband, he gets like little cuts because he's on his feet all day long. So for him, he'll get like these cuts. I wonder if they have things for that, or even if this product would be good for him.
Yeah, I would highly recommend it. Like I say, I have just been amazed at how well it's done. And my doctor that vets products for our Safe and Sound website, this one is definitely going to get our seal of approval because she's actually had her patients try it. And so her patients are really liking it as well. So I can very definitely say that, you know, anybody that has any kind of issue with their feet, and no matter what the age, you know, like you say, whether you stand on your feet a lot, or you're playing sports, or whatever it may be, you know, the reality is that we don't realize how beat up our feet get.
Yes,
we're on them all day long.
We beat them up,
you know.
Yes,
we do. We beat them up. So
I definitely do. They carry me around all day long.
That's right. Well, they need a little tender, loving care. So we definitely need to try and give them a little TLC.
Yes.
So the other thing that I wanted to talk about is kind of a little bit out of the box for this week, but so there is, and it's actually right down there near you guys' area, which was one of the many reasons why I wanted to bring it up. A woman by the name of Pamela Furr, she had an autistic son, and about 10 or 11 years ago, she decided to start a school for any kind of neurodivergent children. So that means autism, ADHD, ADD, any kind of child that has any of those things. She started the school down in the Fort Lauderdale area. The school, she now has 3 locations. She now has gone up into high school. Her son is now in college. And the school has gone so well that literally people fly their children in from all over the world to go to her schools. It is amazing. She has turned the education system on its heel because of the way she has learned how to deal with children who have any of these kinds of issues. She deals with not only the children, but she helps the parents to understand. She basically, she laughs. She calls herself the mom to all of her children and all of her parents.
Love that.
But she's absolutely adorable. Her name is Pamela Furr. The name of the school is Puzzle Box Academy. Puzzle Box Academy. And you can actually, if you want to look up the name of the school, it's actually puzzleboxacademy.com. She actually has a podcast called The Purple Couch, and she has people come in and talk about all the different problems and issues that people have, whether it's with autistic children or ADHD children, anything like that. There's just so many different things, and she has actually collaborated now with a college, and she is starting to get her kids into college.
Wow.
So she has been able to do things with these types of kids that nobody else really has. I mean, and because she thinks so far outside the box, and she's been able to do it and do it well. She has an entire staff that are just ridiculously amazing. So I don't know if anybody listening, whether they have kids, whether they have grandkids, whether they have a friend who has a child that might be in need of something like this. But I cannot highly recommend enough Puzzle Box Academy. It is absolutely brilliant. When you talk to Pam, you're just going to love her. She's just like the person you feel like you've known your whole life. Wow. And she absolutely loves and meets every single one of her children. And, she just has such a spectacular view on everything. It just really helps a lot. I have a friend who has a child that is autistic, and autism can go anywhere on the spectrum, and so it can be a little bit autism, or it can be a lot of autism, or anything in between, and all those different kinds of things. And at times it can be really challenging. My particular friend, she has 4 kids, and the other 3 aren't. And the one that is, the siblings got to a place where they were like, we don't understand how to kind of deal with the one who has autism, because, she's different. She's just different. Tough. She handles things differently. And, there's all those kinds of issues. And Pam is just a resource that is just, there's no money that you could put on knowing somebody like that when you are in that space. You really need to feel like you can know somebody who knows and understands it. And she is, and her whole team is. And
I'm sure it's as important for the whole family to get the education.
Yes, absolutely.
On this. And I'm sure the podcast, I'm sure she talks about this stuff, and she interviews people. So that's wonderful. And that's puzzleboxacademy.com.
It's Puzzle Box Academy. It is down in Fort Lauderdale. That's where I believe all 3 locations are in the Fort Lauderdale. She is getting ready to, and she's actually already talking to people about franchising it out, because people literally want her to get franchises literally all over the world, because she has such a phenomenal curriculum and way of doing and dealing with all of this. That literally no other school has been able to deal with the way that she has, in such a phenomenal way. So like I say, I highly recommend it. If you know of anybody who has children that are in this space and they're struggling and they don't know what to do or how to do it, I would highly recommend you get in touch with Puzzle Box Academy, and Pamela Furr is her last name, F-U-R-R. And if you want to go to the website, it's puzzleboxacademy.com. That's the website, puzzleboxacademy.com.
And then she has the Purple Couch, right? The podcast?
Yep, and she has the Purple Couch podcast as well. So you can look that up on, I'm sure, all of the podcast platforms as well.
Wonderful. Well, thank you so much for sharing that.
Yeah.
Definitely. And again, if anyone missed that and you would like more information, you're welcome to call United Insurance Experts at 561-464-2273, and we'll be more than happy to connect you with these valuable resources. So let's talk a little bit about Medicare.
Yay!
Yay, Medicare. Okay.
Yes.
I know. Medicare. Okay. So the first question I receive is Medicare coverage the same in every state? Okay. So no. So while original Medicare Parts A and B is national and it's the same nationally, the supplements change. So the plans itself are the ones that differ from state to state. So that's something that you need to look at depending on where you're living, right? So I actually get a lot of individuals that say, well, but wait a minute, my cousin that lives in, New York has something different, or my friend that lives in Boston, Massachusetts has something different. How is that possible? Well, it's possible because Medicare supplements change depending on the state. Now, that doesn't apply to all states. There are many states that pretty much follow the same standardized benefits nationwide, like your Medicare supplement plans, right? They're all pretty much the same on the majority of the states. But what changes is the rates. So depending on where you live, that rate could be different. A lot of times it varies by zip code. Right here in Florida, maybe a zip code in Palm Beach County compared to a zip code in Broward might have a totally different price for the same identical plan. Right. So because I get this a lot when I'm, especially I'm helping an individual with a supplement plan, they'll compare it to a family member or a friend. They're like, wait a minute, I have a friend down the road or just a couple of minutes away. Why are they paying a different price? So you got to think that it goes by zip code, it goes by age, and it goes by sex. So a female, male, they're different prices. Okay. So, in regards to the states, it's different for the supplement plans. Now, Medicare Advantage, same thing. They're totally different depending on where you live. So based on your zip code, that determines how many Medicare Advantage plans are available. If you want to look at all of your options, that's where you would go to Medicare.gov, and you could actually go to their site and look at all the plans based on your zip code. Okay, or you can contact your local agent, or you can contact United Insurance Experts, 561-464-2273. We are licensed pretty much in everywhere in the country. Okay, so next question is, how do state-specific rules affect Medigap policy? Okay, so Medigap policies are, again, standardized across most states, meaning the benefits for each plan type, like, for example, Plan F and Plan G are the same regardless. However, if you live in Massachusetts, Minnesota, Wisconsin, they have it's a different standardized Medigap plan. So if you're in these states, it's not the same. You won't get the Plan G and the Plan F. It's a totally different name. And they all follow different rules. Like New York, you don't have to pass medical questions. In Florida, you only have those 6 months from being eligible for your Part B of Medicare for you to get a guaranteed issue. After that period, then you do have to pass medical questions in order for you to get on a Medicare supplement plan. In New York, this does not apply. So this is just something to consider when looking at Medicare supplements. So from state to state, it could vary. Next question is, are Medicare Advantage plans available in all states? So Medicare Advantage plans are available in all states, but the availability of the specific plan and the type of coverage and then the provider networks and premiums can vary depending on your location. So, of course, if you live in an area like in compared to an urban region, then you can have more options there. So it just depends on your zip code. So again, it's essential for you to compare plans to make sure that you're getting the right one for you. Okay. How does state Medicaid interact with Medicare for dual eligible beneficiaries? So the Medicaid program, which can help cover the cost. So basically Medicaid is covering the cost, your portion of it, right? So you have Medicare and then Medicaid covers the remaining if you have full Medicaid. So you have to be careful. There is partial Medicaid out there, so you won't get that full Medicaid coverage. So again, if you have full Medicaid, then most likely it'll cover the remaining costs for you. So again, Medicare and Medicaid can work together. You can have original Medicare and Medicaid. If you have Medicare and Medicaid and want a Medicare Advantage plan that works in conjunction with Medicare and Medicaid, these are called dually eligible plans. And these are for people that have Medicare and Medicaid at the same time. So you can go on to these Medicare Advantage plans that are called special need plans. These are definitely, I always recommend these plans if you're eligible for both. And again, you have to make sure that your network of doctors are in network. If you're going with an HMO, if you go with a PPO, again, you are allowed to go out of network, but it's always a good idea to make sure that your doctors are in network, okay, before going on these dually eligible plans. Next question is, I get this one a lot. What is the best Medicare Advantage plan? This one's a tough one. I can't really answer this because it's kind of like they're all great. Now, Medicare Advantage plans by law have to give you everything that original Medicare gives you. So they're giving you Part A, which is your hospital coverage. They're giving you Part B, which is your medical coverage. And a lot of them offer additional benefits that original Medicare does not give you, right? They're giving you your prescription drugs. They're giving you gym membership, dental care. So there's a lot of additional benefits that these Medicare Advantage plans give you that original Medicare does not. So again, it all depends on the individual. What are your needs? What are your finances? What networks, right? That will determine which Medicare Advantage plan is the right one for you. Everyone is different. I've had, a household. Sometimes the husband might be on one and the wife, might be on another because they both, even though you would think, well, they're in the same household, they're going to be on the same one. No, they could be totally different. One is taking one set of medications, the other one's, taking other meds. So, or seeing other doctors. I've seen that where, actually my husband and I have different PCPs too, now that I think about it. But a lot of times, I'll have, a husband, he says he feels comfortable with his PCP and the wife has a different PCP. So you got to look at that as well, look at the network, especially when choosing a Medicare Advantage plan. Next question is, I'm 66 years old. Can I keep my COBRA plan? Okay. So one of the biggest issues with keeping COBRA as your primary is that it's not considered credible coverage. So again, in the eyes of Medicare, COBRA is not credible coverage. And what does that mean? That means when the person decides to take Medicare and they haven't had any insurance aside from COBRA, they could be penalized for life. So you don't want that. So as much as you feel comfortable with your COBRA plan, and this is what I get a lot, Tracy, I get people that say, I just, I don't have the energy to get on Medicare. So, I've been on this plan for like 20 years, and then my employer says I can take COBRA, so they'll stick with COBRA. Don't do that. The moment you're eligible for Medicare, the moment 6 months before your 65th birthday, you should be getting the education you should be getting your Medicare education, no matter what.
That's when you call Myriam.
Yes, you can call me. But if for any reason you don't get your education, okay, please, either from Medicare.gov or your local agent, whoever, or of course me, right? That's why I'm here to help you. Get your education because I know that you have probably a good option with your employer, but just compare it. Understand what's the differences. Is that employer plan beneficial to you, right? Understand original Medicare before you select your employer plan. And then again with COBRA is not credible coverage, so be careful with that one if you decide to stay with that one. Can I just use GoodRx and not take Part D of Medicare? Okay. Another one that I get a lot. Part D plan premiums range from $0 to $196 a month. So, and this is for 2024. There's no reason for you to use a discount card when there's options that are super low. Okay? Yeah. Keep in mind, Medicare will penalize you for not taking a prescription drug plan. You have no idea how many individuals I get that are like 70 years old and they're like, okay, I'm ready for Medicare, and they have not had a prescription drug. Some of them have like no insurance whatsoever. I know. It's shocking to me. They're like, I'm super healthy. It's not about that. It's about I'm great. It's great that they're healthy, but now look at the consequences. You're going to pay lots of money in penalties. So be careful with that. GoodRx, I recommend GoodRx. Absolutely. But again, be careful because GoodRx is not coverage. And in the eyes of Medicare, it's not credible. And you could be penalized when you do decide to take Part D. Now, if you have a Part D plan and you have GoodRx and you want to use it because it's not covered, then that's okay.
I was just going to say something. My mom got on a Medicare Advantage program literally as soon as she turned 65. And it has been a really, really, really good plan. And honestly, when my dad passed, and our money situation has been tight, it has been a godsend. She's had to go to the hospital twice. I literally only had to pay like $100 for the ER visit, and then she got admitted for 2 or 3 days, and we never had to pay a penny. She never pays for any prescriptions at all. She has dental. It covered like a $5,000 dental bill. She has vision. And then every month she gets like $150 of over-the-counter stuff for free.
Yeah.
It's a phenomenal program, and it has been a godsend. So I highly recommend I can tell people, there have been times when if her medications weren't paid for, it would be crazy because she has a lot of medications.
Yeah.
And so, you really need to be able to look into some of this stuff because it's really worth it.
Yeah. And like you said, she made the right choice when she was first eligible for Medicare. So as long as you do your homework and you get the education and you contact an agent that is there to explain everything and educate you and you make that right choice, you could be on that plan forever. Yeah, you don't even have to make more changes.
Oh, yeah,
Why?
she's been on the same plan literally for 20 years.
Right, because she made the right choice and it still continues to work for her. And that's amazing. I love to hear stories like that. So thank you, Traci, for sharing that. Again, it all comes down to the education and get it as soon as you can. It's okay. I've talked to 63-year-olds. They're like, Myriam, can I get the education now? Absolutely. It's never too early, So it's okay to get the education. Please contact us if you have any questions, 561-464-2273. That number again is 561-464-2273. We're here to help with any questions. Again, we encourage you to continue to send in your questions or give me a call like you've been doing. I just love to hear from everybody. I say you guys can email me, and it's funny. I always get the call, which is fine. I don't mind the calls. So thank you again for the calls. And I do want to hear you guys. So if you guys want to chat, make sure to give us a call. So again, thank you so much. And you guys all have a wonderful Saturday.
Have a wonderful day, everybody.
Thanks for listening to Medicare Made Simple with Medicare Myriam and Tracy right here on Legends 100.3. Medicare Made Simple is brought to you by United Insurance Experts. For more information, call 561-464-CARE. That's 561-464-CARE. Tune in next Saturday at 9 a.m. for more Medicare Made Simple with Myriam and Tracy.